Hello and welcome. So today we're going over what actually tearing means during delivery and birth. So tearing refers to exactly what it sounds like, a tear in through that area of your pelvic floor. Most commonly this is happening in that perineum, and it is graded on grades 1 through 4, 1 being the least severe and 4 being the most severe. So as a refresher, or if you didn't watch the pelvic floor perineal massage video, welcome to your pelvis. Welcome to the bottom of your pelvis. This is your perineum here, and the tearing typically will happen in a downward fashion, can happen upwards as well. If it is going to happen upwards, sometimes they'll do an episiotomy down here to try and have the tear go backwards. Not super fun when things start to tear up towards that clitoris, as you could imagine. So a grade 1 tear is just more so the skin in this area, not super severe, doesn't always require stitching to heal up. A grade 2 tear, you are going through the skin, and then also these muscles here can go any which way, typically kind of straight down. A grade 3 is coming all the way down this way towards that anal sphincter, and then a grade 4 is actually coming all the way down and tearing in to the anal epithelium. So obviously much more severe. The more tearing that happens, the less fun things like peeing, pooping, moving around, sex are all going to be postpartum. So tearing, as I said, is pretty common. It's reported about 85% of women do have some perineal trauma with vaginal birth. That being said, we do have lots of tools to help mitigate that. That perineal massage is an example. And there are some other techniques like breathing and working through that pushing phase as well. Risk factors for tearing are going to be things like vaginal birth, obviously, your first vaginal birth. If your baby's particularly large, positioned in a not ideal manner, the older that you are, if they had to use forceps, what position you're in as you're delivering the child, if you've had a really long pushing phase potentially, and then interestingly kind of higher socioeconomic status, potentially because you are getting a little bit more interventions, a little bit more care, so they're easier time reporting on those. Pretty much what we are looking to do is just get the information out there and then take steps to kind of help mitigate some of those things as well. So the final piece when we're just talking about the tearing is, okay, I tore, now what? Am I doomed? No, your tear will heal and will recover. The thing to keep in mind is the larger the tear, the longer recovery. Some other things that can happen after you've had that tearing are you can end up with uncomfortable or sensitive skin in that area. The healed tear is going to have scar tissue. Scar tissue is never going to be exactly the same as the pre-torn tissue. This is true of anywhere in your body as an adult, but basically your body starts to become more and more similar at that torn site to not torn site. Sometimes we just have to help it along a little bit. So next video we'll go over some postpartum perineal massage techniques as well as some desensitization, some stretching, other things that you can do. So no, you're not doomed. Yes, it should get better. If you've had more severe tearing, you do have increased risk of urinary or fecal incontinence, aka leaking through either of those places when you're not expecting or not wanting that to happen. That's a whole separate topic. Just do know you should and could get a pelvic floor referral for that, for physical therapy. And those are things that'll be dived into a little more in the future here, but those are really things that you want to talk to your OB or care provider about and have them refer you to the appropriate resources as far as management. So with tearing, that will heal up anywhere from really quickly, if it wasn't a lot of tearing, all the way up to theoretically around about that 6 weeks time frame. That is partially why your 6-week checkup with your OB happens when it does, because depending on how much kind of trauma to the area you've experienced, that is a nice appropriate timeline for when things are kind of back to normal or recovered from like a medical standpoint. Sort of similar to if you like broke your arm or whatever, right? They're checking in on you at standard time frames with the expectation that around about that 6 weeks, everything should be good to go. So if you're not so sure, some people can actually tell that they're healed. If you're not sure if you are or not, that is something that you can kind of just ballpark expect to be recovered around about that 6 week time. Recovery in this case does mean not actively still torn, risk of bleeding, that kind of stuff. Recovery does not mean back to like normal function, pain-free, normal extensibility or flexibility of those tissues. That's what all of this is about, is to help get you back to that actual normal, which is what you can do in that rehab side of things once the initial structural integrity is intact enough to do that. In the initial phases, while everything is healing up, this is a great time to either use ice packs, sometimes heat, depending on what your care provider has said, as you're going to the bathroom, using like the peri bottle that the hospital provided, or kind of a comparable one to help keep the area clean, help kind of desensitize it. So something that I found to be helpful, even if it wasn't the most overly pleasant, was actually using cold water in my peri bottle, because it felt really similar to sticking an ice pack down there, and I would go to the bathroom, just use my cold water peri bottle, breathe through it, and then that just kind of helped leave everything feeling kind of calmer and cleaner subsequently. Thanks so much for watching. I hope you found this useful. Remember to like, follow, subscribe if you are interested in a little more content. And again, check out the pushing video that's upcoming, as well as there will be a postpartum perineal massage video too.